everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as Nurse with the Difference, and I make learning easy and accessible for students. Today we're going to be talking about the nursing objective, how to write the nursing objective. In our previous video, we gave an introduction of what the nursing care plan is and also how to write or make a good nursing diagnosis. But today it's specifically going to be how to write a good objective alongside with the evaluation. But before we go into details, kindly click on the subscribe button, turn on the notification button so you don't miss out. Let's go there. Welcome back. Like I earlier said, today we're going to be talking about nursing objective. What do we mean when we say nursing objective? When we say a nursing objective, we simply mean the goals of the nurse, the expected outcome, what we hope to see at the end of a particular care. That is the objective. So that is why we wrote on the board, objective describe what the nurse hoped to achieve. What the nurse hoped to what? What the nurse hoped to achieve by implementing the nursing intervention, and these are derived from the client's nursing diagnosis. So whenever you hear nursing objective, it's simply what the nurse hoped to achieve at the end of a particular care, what the nurse is expecting. For example, a patient having pain, our goal should be what? Our objective should be to reduce that pain, right? That is objective. A patient having hyperthermia, that's increase in body temperature, our goal, our objective should be what? Should reduce the temperature. A patient having difficulty with breathing, our objective should be what? To ensure that this patient breathes at a normal respiratory rate. So whenever you hear goals, whenever you hear objective, whenever you hear expected outcome, they are talking about what the nurse hopes to achieve at the end of a particular nursing intervention. And you can get that when you already know the nursing diagnosis. Because you have to I've assessed this patient is having hyperthermia, so what will be my objective? So your objective is going to be, I'm going to reduce this patient's temperature. Do you understand now? So whenever you hear nursing objective, it's simply what the nurse hopes to achieve at the end of a particular intervention, nursing intervention. And this is usually derived from where? The nursing diagnosis. So the various types of goals, the various types of objective. We have the short-term goals and the long-term goals. The short-term goals are those goals that are accomplished within days, hours, hours. For example, a patient having difficulty with breathing, you expect to tackle that immediately, right? A patient having hyperthermia, you expect to tackle that immediately. So those are the short-term goals. While long-term goals, they can take months, they can even take years to accomplish. So those are basically two types of what? Nursing objective. Then that takes us to that's the characteristics of a good goal, or the characteristics of your objective when writing it, what you should take note of. Objective should be SMART. The first one is that the objective should be specific. You should be specific. Oh, this is what I want to do to my patient. I want the temperature to reduce by 1 degree Celsius after so minutes of nursing intervention. You are being what? You are being specific. You are not generalizing it. Then another is, it should be measurable. It should be what? It should be measurable. Then A, achievable. You have to set achievable goals. You don't have to set goals that you know they are not achievable within a particular time frame. For example, a patient that just is placed on traction. You can't set a goal like after 2 days my patient will walk. Those goals are not achievable. So you have to set what? Achievable goals or objective. It should be realistic, something that is real. So don't set unrealistic goal. Then also time bound. Your objective has to be time bound. Within so minutes of nursing intervention, within so minutes of hospitalization, you have to put time. This characteristics of objective or goals is not only applied in nursing care plan, it is also applied in our individual lives. When we set goals, those goals has to be what? They have to be specific, they have to be measurable, they have to be achievable, they have to be realistic, and they have to be time bound. There's something I wrote in the board, client conscious. Most of us, we make nursing diagnosis and create our objective without taking into consideration the client, without taking into consideration the patient. Whatsoever you are going to be doing as a nurse, your focus should be what? Should be the patient. So when you are saying your objective, you will not say the nurse will notice, no, or the nurse will. The patient is who you are talking about. Patient will, not nurse will. I don't know if you get now. When writing your objective, you as a nurse, forget yourself and put the patient in place. Patient will verbalize less pain. Patient's temperature will reduce. You are focusing on the patient and not what you think when writing your words, your nursing objective. So I'll be giving some examples of some nursing objectives. The first one I have here is pain, for pain. You can see patient will verbalize less pain within 30 minutes of nursing intervention. You can see it's time bound. You can see it's specific. We are saying the patient will verbalize what? Less pain within 30 minutes of nursing intervention. Since we are treating this alongside with the evaluation, patients will verbalize less pain within 30 minutes of nursing intervention. What will the evaluation be? The evaluation is going to be like a past tense because that's already been done. So it will now be patient verbalized. You remove this will when writing what? The evaluation. It will now be what? Patient verbalized, because it's past now. Less pain within 30 minutes of nursing intervention. When you are writing your objective is what? Patient will verbalize less pain within 30 minutes of nursing intervention. But when you are writing your evaluation, it's going to be patient verbalized, because it's now past. That's why I say objective and evaluation, they go what? They go hand in hand. So in example, how I normally write my care plan, when I write the objective, is an exam. I'm not in a clinical setting. So when I write my objective, I write my evaluation immediately, because it's more or less like they're similar. So for example, at this one, we are talking about anxiety now. Patients will verbalize, oh madam, I'm feeling better now. Patients will verbalize reduction of anxiety within 1 hour of nursing intervention. But when we're talking about the evaluation, you remove what? You remove this will. It will now be patient verbalized reduction of anxiety within 1 hour of nursing intervention. Then the other one I have here is respiratory difficulties. Patients will breathe at the rate of 18 to 20 cycles per minute within 20 minutes of nursing intervention. You can see this thing is specific and it is time bound. Patients will breathe. That is the objective. So when you are now writing the evaluation, what will it be? Patient breathes at the rate of 18 to 22 cycles per minute within 20 minutes of nursing intervention. Then this one I have here, okay, for temperature. Patient's temperature will reduce by 1 degree Celsius within 20 minutes of nursing intervention. So if I'm writing the evaluation, it's going to be what? Patient's temperature reduced. So if you are writing evaluation, just remove the will and change this action word to past tense. So in exam condition, when you write the objective, the next thing that should come to your mind is what? Evaluation. If you're having a patient having imbalanced nutrition, less than body requirement now, your goal, your objective should be that, oh, my patient will gain weight, maybe 1 kg, maybe 2 kg, or maybe few kgs within so period, within a week, within 2 weeks of nursing intervention. So whenever you know your objective, writing your evaluation is very easy. And sometimes most students get confused. Oh, am I to write within 30 minutes of nursing intervention or after 30 minutes of nursing intervention? Let me explain. In your objective, you wrote within 30 minutes, right? So in your evaluation, you are free to write within 30 minutes, not after 30 minutes. It will look as if you don't know what you are doing. because it ought to be within that 30 minutes. If you want to use the word after, it has to be less than this 30 minutes. You cannot say after 15 minutes, after 20 minutes, after 25 minutes of nursing intervention, not after the time which you gave. So that is when to use after and within. Don't forget, objective is what the nurse hopes to see in the patient, and there are two types of objectives, two types of goals, which are the short-term goals and the long-term goal. In terms of your objective must be SMART: specific, measurable, achievable, realistic, and time bound. Thank you very much for watching our video. Thank you very much for staying tuned. Don't forget to like, don't forget to drop your questions in the comment section, and don't forget to share with a friend if you got value. For those that have not registered for our Telegram class, bet you have been missing a lot. So tomorrow we are going to be talking about nursing intervention and the scientific rationale. So get ready as we talk about nursing intervention and scientific rationale tomorrow. See you in our next class. Bye.